Greetings. Let us learn about wire-guided bougie dilation of esophageal strictures. Wire-guided bougie dilation is typically used in the management of an esophageal stricture that is very tight or very long or very angulated. And these are the features of a complex esophageal stricture. Wire-guided dilation could also be used in a simple esophageal stricture that is wide open, short, straight stricture. A typical example is a Schachke's ring. They can also be used in the management of esophageal webs. Let us see and learn about Savary dilation kit. And here you see the Savary dilators. These are a series of dilators starting at 15 French to 60 French. Going up 3 French to the next dilator from 15, 18, 21, like that to 60 French. 3 French is equivalent to 1 millimeter. So the Savary dilators are, in otherwise, if you want to know in millimeter size, they go from 5 millimeters to 20 millimeter size. That is something important to keep in mind. The dilator goes over a metal wire with markings, otherwise known as Savary guide wire. And for the dilator to move smoothly over the guide wire, we require silicone oil to lubricate the dilator and a water-soluble gel and gauze to lubricate the Savary dilator on its top and around so that it goes down the GI tract easily. Let us learn about Savary guide wire. As you can see here, there is a spring coil tip, and that is the tip that you should give it to the endoscopist. You should not give the other end, that is blunt, sharp end. And the spring coil tip, when it goes into the stomach and it meets resistance, the spring coil allows it to deflect and avoids unnecessary damage. And you can see there are markings on the Savary wire, and let us learn about those markings. As you can see here, each dot, there are the first from the Savary wire spring coil tip. As you come down, you see 2 markings, and then on the right side you see 3 markings, 4 markings, 5 markings. Each mark is equivalent to 20 centimeters. So 2 markings is 40, 3 60, 4 80, and 5 100 centimeters. And it's important for endoscopy assistant to know how many markings are just outside the mouth. If we see 2 markings, you should think that only 40 centimeters of the wire is inside. And if you know where the GE junction is, normally in an adult is at about 40 centimeters. That means the wire tip is at the GE junction. If you see 3 markings just outside the mouth, that is, the wire is 60 centimeters inside the GI tract. That means the wire is gone beyond the GE junction and is lying somewhere in the antrum of the stomach. So that is something to keep in mind. And if you see 4 markings, that means you have too much of wire coiled in the stomach, almost 80 centimeters. So something to keep in mind. So let us learn this again. 2 markings is 40 centimeters, 3 markings is 60 centimeters, 4 is 80, and 5 is 100 centimeters. I want to In Savary dilation, you place the guide wire in the stomach, and over the guide wire, the Savary dilator moves in and out like a railroad. It's like a railroad technique. So I want to show you once that brief technique, and then we will go into details. So here is a wire that has been passed into the stomach, and you see 3 markings at the front of the left hand of the endoscopist, just outside the mouth. That means the wire is at least 50 centimeters into the stomach, because the 3 markings is at 60 centimeters close to the hand. So you load the Savary dilator and then pass it down the wire to the endoscopist, and the endoscopist lubricates and then passes it into the esophagus to dilate the stricture. And once the stricture is dilated, he will pull it back, and the endoscopist takes it out and loads the next dilator. It is as simple as that. The most important thing for the endoscopy assistant is to hold on to the wire and not allow it to slip in or slip out. So let us see how Savary dilation is actually done. So the patient undergoes a procedure under sedation. The endoscopist goes down into the esophagus and introduces the Savary wire through the biopsy channel down the esophagus, through the stricture, into the stomach, all the way to the antrum. So inserting the guide wire into the antrum is the first step. For the sake of the assistant, I want to make a point. The spring tip is pretty flimsy, so the endoscopist will appreciate if you puncture the biopsy port cap with a blunt tip of a syringe needle, blunt tip of a syringe, so that the wire can be introduced easily. Once the Savary wire is in, the next step is to remove the endoscope while feeding the wire and make sure that the wire is in the antrum. If the procedure is done under fluoroscopy, this can be monitored under fluoroscopy. If it is not done under fluoroscopy, a seasoned endoscopist with a lot of experience will do the wire exchange, keeping the wire in the stomach without the need for fluoroscopy. Once the wire is out, the wire tip should be held by the assistant at a fixed point. You can see the interrupted line, and I put it there to make it a point that the wire should be fixed at that point. It's important to stabilize the wire and also confirm the position of the wire by checking the number of marks just outside the mouth. Here we see 3 marks, that is 60 centimeters at the endoscopist's left hand, and that would equal to about 50 centimeters inside the patient's body. The next step in dilation is to lubricate the dilator using silicone. That allows the dilator to move down the guide wire smoothly. And then pass the dilator while avoiding the wire slippage, either in and out. So the assistant should hold on to the wire. And once the dilator comes to the endoscopist, it's important to lubricate the dilator tip at the mouth and insert the dilator along the wire. And this dilator, as it goes down, the endoscopist will feel some resistance, and then he will dilate it. And as this is happening, the assistant should secure the wire and not allow the wire to either move in or move out. Once the endoscopist is satisfied with the dilation, he will gently pull the dilator back over the wire while the assistant is stabilizing the wire. So from the assistant's point of view, there are 3 or 4 important steps. One is to hold on to the wire and not let it move in and out, and see where the wire is outside the mouth. If you see 3 marks, that means you're in pretty good shape. That means there's adequate amount of wire inside the stomach. If you see only 2 marks, that means the wire has slipped out, probably come into the esophagus. If you see 4 marks, that is 80 centimeters, that means there is too much of wire in the stomach, overcoiling inside. And so these are the things in relation to the wire management. When it comes to assisting with the dilator, it's important to lubricate the tip of the dilator with silicone and to allow it to slide down the Savary wire easily, and then lubricate the dilator with a water-soluble gel close to the mouth so that it goes down the GI tract easy. While this is happening, stabilizing the wire. That is critical. As you can see here, we are seeing what happens inside the esophagus as the dilator is going. It stretches the esophageal stricture and dilates it. And once the endoscopist is happy, he may ask for the next set of dilators. Usually after the first time resistance is felt with a particular dilator, the endoscopist typically goes up by at least 3 more sizes. And after completion of the dilation, the dilator is removed along with the guide wire, and you insert a scope to check the effects of dilation, whether there is a mucosal tear or a perforation. What is rule of 3? Rule of 3 is what we talked about. When the endoscopist feels resistance with the first dilator, he goes up for the next 3 sizes to get the maximum benefit from the dilation. And along the way, depending upon the amount of resistance the endoscopist is feeling, he may back off and not go completely to rule of 3. Typically, they stop after 3 more sizes of dilations. Coming to the adverse events, if mucosal tear can result in bleeding. If the mucosal tear is deep, it may result in perforation, and the mucosal tear from the dilation could result in chest pain. So we talked a lot about Savary dilation. I hope this is useful. Thank you.